Let's start with a bold question. Does morning lemon water really detox your body, burn fat, and fix your skin, or is it mostly hype? According to a critical review published in the Journal of Human Nutrition and Dietetics, so-called detox drinks rarely show clinical proof of toxin removal in healthy people. In this video, we will test 9 other big claims using real studies from peer-reviewed published literature. If you stay to the end, there is a practical bonus routine you can use tomorrow morning. Quick disclaimer: this video is for education only and not medical advice. If you have kidney stones, acid reflux, dental issues, or take prescription medicines, please talk to a licensed professional before changing your routine. Ready to separate ritual from reality? Let's dive in. Detox is not a drink. It is your liver and kidneys working around the clock. According to clinical physiology texts and a review in the Journal of Human Nutrition and Dietetics, the liver uses phase 1 and phase 2 enzymes to transform chemicals, then ships them out in bile or urine. According to Mayo Clinic, your kidneys filter blood, balance fluids and electrolytes, and excrete waste all day. There is no strong evidence that lemon water increases toxin clearance beyond what plain water and a fiber-rich diet already do, as highlighted by the Journal of Human Nutrition and Dietetics review. Up next, if detox is not the benefit, could hydration be the real win? Hydration is about how much you drink, not the slice you squeeze. According to a large evidence review in JAMA Network Open, increasing water intake itself improves hydration markers and can support weight loss when it replaces sugary drinks. According to Mayo Clinic, typical daily fluid targets are approximately 2.7 liters for women and 3.7 liters for men from all beverages and high-water foods. Lemon can help some people drink more because it tastes better, but the hydration effect is the same as plain water at the same volume, as summarized by JAMA Network Open. Quick call to action. If clear, evidence-based health videos help you, please subscribe so you do not miss the next Mythbuster. Is warm lemon water special? According to Mayo Clinic, warm, room temperature, and cold water hydrate equally when volume is matched. Some small clinical observations show warm fluids can feel soothing and may nudge gut motility after fasting, but the hydration gain comes from drinking, not from temperature. Morning timing helps because routines stick. A water habit after waking is a strong behavioral cue, a point echoed by habit research and the JAMA Network Open review on water routines. Transitioning next, if hydration is the real lever, what about weight and appetite claims? Lemon water does not melt fat, but swapping it for sugary beverages cuts calories. According to JAMA Network Open, people who add water and reduce caloric drinks lose more weight than those who do not. A small trial discussed in the Journal of Human Nutrition and Dietetics showed that a very low-calorie lemon cleanse led to short-term weight and insulin changes, but similar calorie control without lemon produced similar results, showing the calories, not the lemon, did the heavy lifting. Bottom line, the ritual can support weight goals by replacing calories and anchoring your day, but the lemon itself is not a fat burner. Want a simple, testable tactic? Drink water before meals. According to clinical trials summarized in JAMA Network Open, about 500 milliliters of water before meals can help some adults eat fewer calories and lose more weight over weeks. Lemon mainly adds taste and helps adherence to the pre-meal water habit. Expect a small effect, not a dramatic one. Coming up, what about blood sugar and that famous glucose smoothing claim? Acidic drinks can slow starch digestion and flatten the post-meal glucose peak. According to a randomized crossover trial in the European Journal of Nutrition, diluted lemon juice with white bread lowered the peak blood glucose by roughly 30% and delayed the peak compared with water. The mechanism is gastric acidity, slowing gastric emptying and temporarily inhibiting starch enzymes. Vinegar can have a stronger effect, but lemon still helps modestly, the European Journal of Nutrition study shows. This matters most when you eat bread, rice, or pasta. Plain lemon water on an empty stomach does not change fasting glucose. Next, the kidney stone question that actually has solid data. Here is where lemon often shines. According to the American Urological Association guideline, Citrate helps prevent calcium stones by binding calcium and reducing crystal growth. In urological research, a trial using about 85 milliliters of fresh lemon juice daily, well diluted, raised urinary citrate about 2.5-fold. In eClinical Medicine Journal, a larger pragmatic trial using 120 milliliters per day of fresh lemon juice with diet advice showed fewer stone events among adherent patients at 1 year, though adherence was hard. A tiny morning wedge is below therapeutic dose. If you are a stone former, talk to your urologist about dosing and monitoring. Lemon adds vitamin C, but not a megadose. According to Cleveland Clinic, juice from one lemon gives roughly 30 milligrams of vitamin C. The Linus Pauling Institute reports that higher dietary vitamin C intake is linked to better collagen formation and fewer signs of skin aging in observational data. For immune support, the Cochrane database of systematic reviews finds that daily vitamin C at 200 milligrams or more does not prevent colds in the general population, but can shorten cold duration slightly. Translation: lemon water contributes, but your whole day of fruits and vegetables matters more. Immunity is not switched on by a single glass. According to the Cochrane database of systematic reviews, routine vitamin C can trim adult cold duration by about 8%, but prevention is minimal in average conditions. Lemon water is low sugar and hydrating, which indirectly supports immune function, according to Cleveland Clinic and Mayo Clinic, but it is not a shield. Pair the morning glass with colorful produce later in the day. Next up, the digestion and reflux debate. Many people feel a warm drink gets things moving. Small clinical observations show warm fluids can cue the gastrocolic reflex, which can help regularity after fasting. However, citrus acidity can aggravate heartburn. According to the American College of Gastroenterology guideline, citrus juices are common triggers for reflux symptoms. If you have reflux, try very dilute, choose warm, and avoid drinking right before lying down. If symptoms persist, switch to non-acid herbal infusions and discuss options with your clinician. Coming next, your teeth need a plan too. Acid softens enamel. According to general dentistry, lemon juice has a pH near 2 to 3 and can erode enamel with frequent exposure in laboratory studies. According to Delta Dental Clinical Guidance, you can reduce risk by diluting with plenty of water, using a straw to bypass front teeth, rinsing with plain water afterward, and waiting about 30 minutes before brushing so enamel can reharden. Drink it, do not sip all morning. Quick call to action. If you find these practical tips useful, please subscribe so more evidence-based guides reach you and your friends. You may hear that lemon water alkalizes your body. According to MD Anderson Cancer Center, your blood pH stays tightly controlled by lungs and kidneys and does not meaningfully change with diet. Diet can change urine pH, and citrate from lemon metabolizes to bicarbonate, which can alkalinize urine, but that is your body removing excess, not changing blood chemistry. Focus on overall diet quality rather than pH tricks. Next, let us compare lemon water with other drinks. For hydration, lemon water and plain water are equals when volume is matched, according to JAMA Network Open. For post-meal glucose, lemon with high carbohydrate meals can help a little, while vinegar often has a larger effect, according to the European Journal of Nutrition and vinegar trials summarized in nutrition journals. For kidney stones, citrus with high citrate and low sugar, like lemon or lime, beats sugary lemonade, and this aligns with American Urological Association advice. Choose the tool that fits your goal and your taste. Everyday habit target: 1/2 to 1 lemon in 300 to 500 milliliters of water, once or twice a day. This keeps acidity lower and supports hydration. For stone prevention under medical guidance, studies used about 60 to 120 milliliters of lemon juice daily, well diluted across the day, as shown in Urological Research and eClinical Medicine Journal. Use unsweetened juice. Pick warm or cold based on what you will consistently drink, as Mayo Clinic reminds us that adherence beats perfection. First, weight and appetite. Water preloading helps some people, but when calories are tightly controlled, extra lemon offers little added effect, as summarized by JAMA Network Open. Second, hydration. People feel better because they drank more total water, not because lemon hydrates better, a point consistent with JAMA Network Open. Third, Stones. Benefit needs enough citrate for long enough. Small sips or poor adherence show little change, as seen in eClinical Medicine Journal where adherence determined outcomes. Context, dose, and duration explain most conflicts. Main risks are local, not systemic. Teeth and reflux deserve attention, as general dentistry and the American College of Gastroenterology advise. Grapefruit interacts with many medicines, but lemon is not grapefruit. The American Heart Association and pharmacology reviews note far fewer furanocoumarins in lemon. Citrus allergy and migraine triggers are uncommon. Monitor your own response and adjust. If you have kidney disease, lemon is low in potassium, but still check with your clinician for personalized advice. Keep it simple and affordable. Fresh lemons or 100% bottled lemon juice both work when diluted. This matches practical advice echoed by the American Urological Association literature for citrate strategies. If lemons are pricey, drink plain water and get vitamin C from oranges, berries, or peppers, as Cleveland Clinic suggests. Use habit cues. Keep a clean bottle on your desk, prep slices at night, and link your morning glass to an existing routine. Next is your bonus, a ready-to-use morning system. Step 1. Place a large glass by the sink tonight. Step 2. On waking, add 1/2 lemon to 400 milliliters of warm or room temperature water and drink it within a few minutes. Step 3. Rinse your mouth with plain water and wait 30 minutes before brushing, following Delta Dental guidance. Step 4. If eating a high-starch breakfast, keep a small glass of lemon water on the table to sip with bites, applying the European Journal of Nutrition findings about post-meal glucose. Step 5. Set a gentle reminder for an afternoon plain water refill to hit your daily fluid target from JAMA Network Open. Here is what actually works and why it matters. First, your organs already detox. Lemon water is not a cleanser, as reviewed in the Journal of Human Nutrition and Dietetics. Second, the real win is hydration and habit. More water and fewer sugary drinks drive results, as shown in JAMA Network Open. Third, lemon can slightly smooth post-meal glucose with carbs, per the European Journal of Nutrition, and can support citrate for stone prevention at adequate doses, per eClinical Medicine Journal and Urological Research. Protect your teeth and watch for reflux, as advised by General Dentistry and the American College of Gastroenterology. Educational only, not medical advice. Now, your turn. Comment the next health topic you want us to test, and let us know how you take your morning water.